My name is Kim Ebinger. I'm a physical therapist with Health Reach Rehab. I've been doing lymphedema treatment since 1999, so treating swelling disorders of a variety of kinds. So let me tell you a little bit about what it is I do. Lymphedema is a condition that people are either born with or can acquire as a result of some trauma to their lymph nodes, some sort of dysfunction with their lymphatic system. Often people will think about lymphedema when they think about arm swelling following breast cancer surgery and having some lymph nodes in their underarm, in their axilla, removed or irradiated with radiation treatment. That is much less common these days because of the advances in treatment, surgical and radiation treatment, and really the desire to try to not impact lymph nodes like they had to in the past. So lymphedema can be something, as I said, that you're born with or something that you acquire. And lymphedema that you're born with will present either when you're first born. It can happen to any body part. You can get it when you go through puberty, and oftentimes it happens in people's legs, but again can happen in their arms and their face. It tends to happen more to women than men. Or another time that it shows itself is when you're in your mid-30s. So lymphedema actually is relatively rare, but we do see it. The other kind of swelling that we treat, the most common swelling, is called venous insufficiency. So when the valves in your veins don't work the way that they should, and you get leakage of fluid throughout the day, and the ankles that when you woke up looked like your normal ankles in the morning are puffy and swollen by afternoon and evening. There's other reasons that people get swelling, and so we really treat the whole gamut of swelling disorders. The thing I like most about what I do with this treatment approach is oftentimes people have been told that there isn't anything that we can do for your swelling, and then they come and see us, and actually there's a lot that we can do, and there's a significant improvement in quality of life that can occur as a result of our treatment. When you come to Health Reach to be treated by one of our therapists who's specially trained in lymphedema, you'll have a comprehensive assessment, and we'll get to the bottom of what the swelling is about. We'll work with your doctor if you've got other medical conditions to make sure that our treatment is safe for you. And then we will involve you in a couple of different treatment modalities. The one for sure that you'll be involved with is something called manual lymph drainage, and that is a massage technique, a very light massage technique designed to move fluid from your tissues into your circulatory system. You most likely will experience what we call compression bandaging, which is multi-layer wrapping of your swollen extremity. It's not tight like ACE wraps, it's actually short stretch bandages that we use, multiple layers, one on top of the other, and that works really, really well for moving fluid out of the tissues into the circulatory system. On occasion, we may use what's called a vasopneumatic pump, which helps to milk fluid out of the swollen body part. The thing that I think that we do really, really well is we work with your unique needs. We come up with customized solutions in terms of long-term compression to keep fluid out of an area. And we acknowledge that you want to move away from focusing on the swelling condition that you have to living your life. And so we place our emphasis on that as well. Health Reach is fortunate to have almost 20 therapists who have been specially trained in lymphedema treatment, which means we're able to provide that service at all of our locations and to provide it in people's homes as well. If you or someone you know and care about has a swelling problem and they've been told that there's nothing that can be done, send them to us. Swelling that lasts for longer than 6 weeks is not normal, and more often than not, there's something that can be done to address the problem even if it's in a small way, and to provide you with the tools you need or the patient needs in order to self-manage their swelling concerns moving forward.